here, and I don't know how long I will have this live up, but especially if I get a phone call from my wife. I had gone to the emergency room on, I can't even remember now. Everything's been running together. Thursday morning, and unfortunately, our local hospital's been so bad that I waited over 8 hours, and in the waiting room, I got to see triage right away, but sat there breathing really hard and everything, and they were so full that they were creating exam rooms in the most random places just to get people taken care of. And from what I understood, they had 216 people in waiting to get rooms that had already been examined and everything else. So people were stuffed everywhere. So I went home after I got antibiotics and everything, and you can hear I'm still wiped to heck, but I also felt better enough today that I got some dishes done, and then my in-laws' church delivered some food for us, which was really nice. And so that really helped out. I just got done unpacking things, and I didn't ask for it, but the one of the family friends and then the minister went and decided to set up care packages for us. So I really appreciate that, because now that I'm going on to 48 hours of antibiotics and I should not be contagious anymore with whatever this is. Honestly, I tested negative for COVID. I tested negative for RSV, which I hate to tell you, thank the goddess for that one, because that one I have actually seen kill pre-teenagers. I have seen it kill adults. And that one, RSV, is really nasty. So tested negative for that, tested negative for influenza A and influenza B, which I did have my flu shot this year, and normally I don't get them, but whatever this wasn't in that. I am going to have to start getting the pneumococcal vaccine, though, because I have bacterial pneumonia and I have a viral sinus infection. Well, things, now my wife, Troy, is as stubborn as I am, and she's got insurance. I make sure that she has insurance. I don't have any because we can't afford both of us. And because she is only 50, Medicare and supplemental, you have to pay premiums. Once you're 65, you don't. So it's as much as regular insurance, not through the marketplace, but private pay insurance. So that does not include me. There is no family plan, so I put her on it and made sure that she's got coverage because of the dialysis and future kidney transplant. And at the time, she was getting the seizures, and those have resolved, and the MS. And so, yeah. But she is pretty stubborn, and she's had a cough now for well over a month, and it just never ever goes away. And this last week it started getting worse and worse the same time mine did, and I'm like, well, you need to go in too, but that's like pulling teeth from a chicken, and she makes her own medical decisions. That's not my place. I can advise, I can push as much as I can, but, you know, she's her own person and has no problems making decisions, but she's stubborn. So, last night, 1 o'clock in the morning, she was in the bathroom and needed help getting dressed and stuff. And usually that's what I end up doing, but I also heard the toilet lid bang. She has trouble moving around. Sometimes can be just with a cane, and other times I have to use the wheelchair. And there's days I have to have a transfer belt and pivot transfer and do all that stuff. With MS, it depends on the day. And it's primary progressive MS, so there is no remission in it. It does slowly progress, and unfortunately, in 2020, the plague went and had triggered it, and as far as the progression, pretty much advanced it by probably what would have been 10, 15 years. So that was an issue. So I got up, went to help out, kept trying to get things together, and she's wheezing, and I can hear the breath sounds from across the bathroom. So I shoved batteries in the oximeter and stuck that on her finger, and her oxygen was at 75%. So I called 911. Good show for the neighbors because the whole street was lit up. So at first they tried to kind of say a little bit that, is this, they get an attitude that, oh, it's just a dialysis patient. I have seen this so many times. I have had people say in front of patients, oh, it's just a dialysis patient, not even referring to them as human. And we're talking people that are cisgender, that they just say it. Like, once you're on dialysis, you are not human anymore. And that's something that I push for, that we need to change. And that's why I'm saying it here too. But I got a little bit of that kind of pushback last night. But I said, normally she's not on oxygen at home at all. And I said, and this isn't right. This is the results I got. Well, the paramedics got the same thing. So out the door with oxygen and off to the hospital. So she's still there. She has pneumonia. Share alike. Been moved all around the hospital, the same problem. They are so crowded. It's inner city hospital. It is so crowded. But she hasn't even been there 24 hours yet and is weak and tired and on IV antibiotics to try to get rid of the pneumonia. But yeah, it's been. So sorry if I sounded a little bit kind of cryptic on my posts. I can't return back to work until the 9th, according to the doctor. So hopefully, they'll have me in a little bit lighter duty, but I oftentimes don't know what the definition of lighter duty is. Not gonna lie. Been an RN almost 30 years now. Come June, it'll be 30 years. And so, yeah, I don't exactly know the definition of light duty. But I have to, because I'm going to have to help take care of her here too. So I just wanted to let everybody know. And yeah, I'll be missing 2 weeks of work. So that's going to be a challenge for a while. There's a link down below. No obligation. No, you don't have to. I'm just happy if you guys just listen, and know that we're okay. Well, we will be. Add a Q&A sticker, favorite seat on the couch? What the heck is YouTube trying to get me to do? I don't have a couch. We have a very expensive fancy lift chair that I did have help getting that thing done, Oh, and this is the eczema again. My one day, well, actually a day and a half of washing my hands with hospital soap. And this is why I can no longer work in the hospitals. It hurts right now. But in case everybody ever wondered, because I miss being in the hospitals working. I was making buku bucks as a hospital dialysis nurse. I loved it. But, I just can't anymore. So, yeah, that's the update. It's possible that Troy's going to come home probably Monday. They might do dialysis first. I hope so, because then I don't have to drag her to the dialysis unit after picking her up from the hospital and then work that night. Although I think I might still keep Tuesday night off, just because it's going to be a lot. So it might be my best decision since I'm recovering too. But yeah, just let you guys know, warnings about how some patients are treated, especially, like I said, dialysis patients. They tend to blame the patient more often than not, to say it's their fault, or, like I said, dehumanize them and call them it. And also, if you are a dialysis patient, try not to miss treatment. I don't care how crappy you feel. And I keep telling my wife that, because she did miss Wednesday. But she also was feeling really crappy. And I'm like, well, do we need to go in? Do we need to go in? And she didn't want to go in. So, sorry, sinuses are filling up again. Yeah, so keep that in mind. If you are on dialysis, you gotta do those treatments, because you don't know when something like this is going to hit, and that extra fluid on you is going to make it so much harder. Because oftentimes it will sit in the lungs, and if you have pneumonia, it's going to sit in the lungs and make it worse. Otherwise, I know I still run into people that say, that they don't trust vaccines and everything. If you're of age, at least get the pneumonia one, because pneumonia can set you on with a trach, a hole in your throat, and a machine breathing for you. That happens to a lot of people that are, what's the word? Like I am. I'm over 55. Older. Well, we'll use the term older because my English isn't Englishing. But do at least get the pneumonia vaccine. This stuff is hideous. And bacterial pneumonia or the pneumococcal pneumonia can kill you too. If there isn't somebody around to give you a tracheostomy and get you on a ventilator. And oftentimes when it comes to pneumonia like that ventilation ends up being permanent for the rest of your life. I'm not kidding either. But the other side of the coin is it can kill you. And I was being stubborn because I don't have insurance. I was trying to nurse myself back to health, and at some point my oxygen was below 90%. And I just couldn't do it anymore. I was so sick I could barely walk. I was that weak and could not stop coughing and coughing and coughing. And I could hear everything piled in here. I could just hear the crackles as I breathed, and I still occasionally get them. And then if you do go into the ER, another thing too is they tried to say it was just the sinus infection. A viral one is going around right now, and it's postnasal drip. And I'm like, oh, how's it postnasal drip if I've got nothing draining? I had a migraine that was like an 8 out of 10, and it wasn't a migraine. It was just all sinus, not draining at all. I'm like, so if that's not draining, how the heck am I getting all this fluid up? Well, then, I don't know what she saw on my x-rays, or wasn't the chest x-ray, it was my labs. And so all of a sudden they did a chest x-ray, and that's where they had found the fluid in the, bilaterally, which means both sides, down at the bases, which means at the bottom of the lungs. So yeah, definitely pneumonia. So you really gotta, when you're in the emergency room now, don't be a Karen, don't be obnoxious. Sorry, Karen, I love you, darling. I know somebody is named Karen. She is a sweetheart. But I'm meaning the thing about people that get overly obnoxious for no reason, that sort of thing. I'm meaning it in the meme sense here. Sorry, Karen. But don't be like, where you're sitting there and just unnecessarily writing the staff, oh, I need to get a cup of coffee, I need this, I need that, when you're in the emergency room. Or like, I had a guy, I'm sitting with a mask on, and I'm huddled up trying to keep myself away from everybody as much as possible in a packed waiting room. And this guy was there for breathing too. He turned around and went over to the desk and asked somebody to come with disinfectant spray because the room stinks and he has breathing problems and this is unhealthy, and he insisted she almost spray me. Now, he was of darker skin tone as well, and I do think there was a little bit racism there on his part. And I'm not saying much because we had nurses from Africa today who were just fantastic. I think one is from Cameroon, and I mean, just nice people. But this guy in the ER was not being very nice. And to actually have somebody spray antiseptic at me because I'm sitting there with a mask over my face, covering my mask anyway when I cough, and staying huddled up in my jacket. But, he was having breathing problems. And he had a mask on too. And then, after he insisted she did that, he gathered up his belongings and left and offered the security guard of the same color to go buy him a bottle of water and stuff. And then he left the emergency room and went to the cafeteria, sounding just fine. So yeah, don't be that person. I shouldn't shout. Yeah, don't be a person like that. That's over the top. But as far as making sure that people explain to you your lab results, people explain to you your tests, why they're taking certain tests on you. If you don't understand something or don't know why they're coming to this conclusion, or you think that they're not quite doing something right, like in my case, saying it was a sinus infection and not going anything further, you have the right to speak up or say, well, how does this affect me? What is my outcome going to be from this mode of treatment? Which at that point, they were giving me an inhaler and Tylenol. And to do the headache. And then they went and did a neb. And they still didn't check my oxygen any further or anything like that. But again, I was insistent, this is not my sinuses. And if you really know your body and know that this can't be the answer, that doesn't make any sense, it's okay to ask, how does this affect me? Or, it's sometimes embarrassing, but sometimes in the emergency room, doctors miss things. Nurses miss things, especially when there's that many people going through. Because they had 300 in waiting just to be seen after triage. I mean, there was a lot. But can you explain this lab to me? I don't understand. And can you tell me, what does this mean? Why are you doing a CT? What is a CT? What is an MRI? What is the X-ray going to show? What are you looking for? Ask those questions. Let them tell you if they have enough time to teach. But be nice about it. Don't be angry. Just say, hey, I don't understand. And sometimes they will find things that, they decide, okay, maybe we do need to do this because something seems weird. And they might not even think that you said something seems weird. But it'll sit in the back of their head and they'll go, huh. And then they'll take it one step further and find something. Especially if it's like you think it might be the flu, it might be something like that. The flu can kill you too. Just to let you know. But yeah, that's the update. That's my little RN public spiel. And yes, you guys can go and kick my butt in the comments, with me being as stubborn as I am. But we're on tight finances, and I was trying everything to nurse myself at home. And at some point, I just couldn't. And if you're in my situation too and used to taking care of things, whether you do home medicines, folk medicines, whatever, if there comes a point that you see there is absolutely no improvement, even if you're doing over-the-counter stuff, like I was using Mucinex and stuff like that, it was not helping. And that's where you got to draw the line and say, I need help. So that's it. In case my wife calls back, I'm going to let you guys go, but needed to just tell you what's going on. Love you all. You take care. Blessed be everyone, and have a fantastic night. And now this one, I don't know how to stop this crazy thing. Seriously. Yeah, I guess I got to hit the button, Frank.